I'm Maggie Gill, the CEO of the Palm Beach Health Network, and today we're turning the page from Candid on COVID to Candid on Care. We've come a long way since the early days of this pandemic. We have developed safe processes in our hospital. We have separate tracks between COVID and non-COVID patients. We've learned how to social distance. We have appropriate PPE. We have safeguards in place. We have trained staff, and we're ready to take care of your healthcare needs. But we understand you haven't been inside our hospitals for some time. We've all been practicing the safe protocols to flatten the curve of the virus, and we're doing a good job at that. So what we want to do right now is give you a glimpse inside of our 5 hospitals in different areas to show you that we're safe. Talking to our doctors, talking to our leaders in the emergency department, in the operating room, in the cath lab. So let's go to our 5 hospitals now and take a look at what's going on inside the 4 walls. Hi, I'm Maggie Gill. I'm the CEO of Delray Medical Center and the Palm Beach Health Network. And I'm joined this morning with Dr. Joseph Ricotta, who's a vascular surgeon at Delray and also the National Medical Director for Vascular Surgery for Tenet. And we are inside the 4 walls of the operating room to share with our community and our medical staff and our employees that we are ready to go to work. The governor's order for elective surgery was lifted. We're safe. Absolutely. And people who have put off care need to come see their doctor and get the care that they need. So Dr. Ricotta, what are you seeing from your patients? Are they feeling uncomfortable at coming to the hospital? Are they concerned? What questions can we answer for them?
Well, first of all, thanks for having me. Yeah, understandably so, the patients are a little nervous about getting their surgery done. There's still this trepidation out there about coming to the hospital and the safety aspect of it. What I tell the patients is that if you leave your home, if you're going outside of your home, there's probably not a safer place to be than the hospital. The hospital is safer than the grocery store. So what we don't want to do is have the patients delay their surgeries because, especially in the vascular world, patients with vascular disease can progress pretty quickly, and something that's a routine problem that can be fixed relatively simply, usually on an outpatient basis where they come in and a few hours later they go home, can become a complex problem met with potential complications and worse outcomes and usually prolonged hospital stays. So the point is, if you have an issue that needs to be taken care of, don't perseverate in your home because you're afraid to come to the hospital, because the hospital is safe. Come to the hospital, let us take care of you, fix you, and then go home to a better quality of life. The hospital is safer than any other place you're going to leave outside of your house.
Thank you, Dr. Ricotta. That is well said. I think that the media and the images on the media really lend to people's concern. But when you're inside the hospital, and that's why we wanted to do this, within the 4 walls, there's not a lot of COVID patients here. The vast majority of patients that are in our hospital are patients who are seeking care and patients who have potentially deferred care like you're talking about. Because we've seen that the amount of people who are presenting for cardiovascular disease, as an example, is down significantly. And it's becoming a trend around the country that people are not coming in for care. So we want to encourage anyone to reach out to your doctor. The emergency rooms are safe. If you have a concern about your health or you have a chronic health condition, come see us. We will take good care of you.
Absolutely. Not just because we're on camera, but I just wanted to take this minute to thank you and let you know that you and your team have done an outstanding job here at the hospital, making this place safe for the patients, but also for the staff. I feel very safe coming to work every day. When I leave my house, in general, I don't feel that safe depending on what I'm doing. But when I come to the hospital, I feel safe. As you said, we have not been overwhelmed, fortunately, with COVID patients. We do have COVID patients here in the hospital, but you and your staff has done an outstanding job creating separate pathways for COVID patients and non-COVID patients. And even if you come to the hospital and you have to stay for a period of time, the hospital is set up, it's almost like 2 hospital systems. It's almost like 2 hospitals. And so the hospital is set up where if you're a non-COVID patient, you are not going to come into contact with the COVID patient. We have plenty of PPE, that's not an issue. We have plenty of testing for patients. And so I just want to commend you and your team for the outstanding job that you've done here. Again, creating a safe environment for the patients, but also for us as the healthcare providers.
Thank you, Dr. Ricotta. It's great surgeons like you that make Delray Medical Center and the Palm Beach Health Network the fantastic healthcare provider that we are. We're here to serve the community. You've rightly described we're a hospital within a hospital. We can take care of you, and that's what we're here to do.
I'm Teresa Urquhart. I'm the CEO for Palm Beach Gardens Medical Center. And joining me here today is Dr. Jody Mahanti. He is an interventional cardiologist here at Palm Beach Gardens Medical Center. And we are here in the four walls of one of our cardiac catheterization labs. And what we are here to do is to tell you that we are ready to go to work. The governor's executive order allowed us to be able to do elective procedures and surgical procedures as of Monday, May 4th. And so we are here to let you know that this is a safe place for you to come to, is the hospital. If you need us, we're here for you. Dr. Mahanti, can you tell me a little bit about what you're seeing with your patient population as it relates to kind of getting back into, going to hospitals and doing things that need to be done?
All right, good. By the way, thank you for having me here. I've been working here for quite some time, and these are unusual times with the COVID. There is a lot of concern with the patients. The patients are a little bit afraid of coming to the hospital, but my message to them is this: probably one of the safest place to be is the hospital, and especially if they are having symptoms. Especially in our field of cardiovascular medicine, there is all these things are not even elective. They are mostly urgent or semi-urgent. So we have to address them. And I think that's what the patients need to understand, that when they are coming to the hospital, they don't need to be fearful about it. They are actually having more chances of getting this condition over in the Publix or walking by the beach or one of those places. So I think that is one of the main concern at this point.
I think that one of the things that really, impacts the community is what they see on TV, right? So with the media, you see a lot of hospitals that are, overcrowded and like majorly consumed of COVID patients. When in reality, here at Palm Beach Gardens, for example, our total population of COVID patients is really a very small number compared to the other patients that we have here in the hospital that we're taking care of. And so one of the things that we have seen, as you mentioned, Dr. Mahanti, is that patients are waiting. And so what happens when they wait and they don't come in for the care that they might need?
Oh, that's a very good point. Actually, that has been our main challenge at this time. Patients are having symptoms for quite some time, and they have been ignoring their primary care physician. They've been ignoring their symptoms. Even their friends and families are telling them to go to the hospital, but they're very scared to come in. And what is delaying is the care is then leading on to more serious problem. Their simple thing, which could be routinely handled as an outpatient, turns into an inpatient admission. They may be staying in a very prolonged state. Actually, I have two patients right now who did not listen to their physicians and did not come to the ER. And then when they did come to the ER, it was actually too late. And we had to do a lot more for them. And they are still in the hospital, intubated and very critical. Have they come, we would have taken care of them very quickly, promptly, and they would have been out of the hospital by now.
Correct.
So I think that delaying and still feeling unsafe is just not the right idea at this point.
Right. And I think part of the reasons they feel that way, again, are they're not sure of what the hospitals are doing to help protect them as a patient, or the physicians, or the employees in the hospital. And I think we have a lot of safety measures in place that allow for the safety of these individuals. Can you talk a little bit about what you're seeing here in the cath lab, for example, some of the things that we're doing for safety?
What I have seen, the administration here, the hospital staff, the nurses, my cath lab staff, they have done a remarkable job. They have actually created two different pathways, and I'm going to come closely to that and explain. If the patient comes to the emergency room, they automatically are screened. If they are screened for them being a positive COVID, they go into a completely separate unit. It's a separate pathway. They do not come in contact with the regular patients. And even if when they are out of the ICU, they go to a special unit which is completely guarded. Nobody can actually enter without the special permission to get in there. So patients, when they think they are in the hospital and COVID patients are just floating around here, that's just a misconception. That is not what is happening here. Then also on top of that, those who are coming to the cardiac cath lab for getting any kind of procedure, those are screened 3 days before with a COVID. So if they are elective procedure 3 days before they are being screened, then they come into a private room. They are coming through an admission site, which is again very private. They come, they are not in contact with any other patients. We do not have too many family members or people coming into the hospital. We have restricted that so that the exposure is less. And while they are in the hospital as well as in the cath lab, the people are wearing masks. The cath lab staff is completely masked. We have a lot of protection for the personal PPEs and so forth. We have not had any patients in the COVID we would have transmitted.
That is very true. And those are all wonderful points, Dr. Mohanty, that you've made. And it's with great interventionalists like you that we've been able to continue here at Palm Beach Gardens to continue the great care that we do for our cardiac patients and our community. We just want everybody to know that Palm Beach Gardens Medical Center, we want our medical staff, our community, our governing board, and everyone to know that we are here for you and we are a safe place for you to come and to get your care.
Hello, I'm Sherry Montgomery. I'm the acting CEO of Good Samaritan Medical Center. I'm joined here this morning by Dr. Spitz, oncologist at Good Samaritan Medical Center, and Dr. Elena Rail. She's a breast surgeon here. Today we're here to discuss safety and as it relates to the safety of the hospital for our patients. Dr. Spitz, tell me, what have you been hearing from your patients and how do you feel about the safety of the hospital?
Well, I'm very comfortable. This is where I work every day. I come here every morning, I make my rounds every morning, I'm here all day, and I want to be safe just like my patients want to be safe. I'm very comfortable telling them, this is the place to come. You should be able to get your procedure done, you should come here, feel that you're getting your medical care and be able to leave without being in otherwise danger.
And I agree, Dr. Spitz. I think, it's important, Sherry, that patients, we recently reopened for screening mammograms, and we're taking a lot of precautions when patients come in. They're being spaced out, only 3 allowed in the waiting room, and with the mammograms, everything's being wiped down as it always is after every patient, and so, we just want to emphasize it's important that patients not delay these screening exams now that we are open and taking a lot of precautions, because delaying things can lead to even worse problems.
Exactly. Patients who may want to put off important or very needed surgeries, chemotherapies, or any other x-rays for diagnosis, they may be putting themselves at a greater risk. Plus, as I understand, the nurses really don't travel from different floor to different floor. They're assigned to that ward, and that's it. If they're working on a COVID floor, they're working on a COVID floor, not the next day on a regular floor.
Additionally, we're seeing a lot less patients than we anticipated, so there's a minimal amount of COVID patients in our hospital, and they are on separate units, and there's a safety protocol in.
These aren't the hospitals that you see in these big cities where there's thousands of people around. I think we have plenty of space.
Not knowing what precautions are in place can be intimidating, but once you get here and you see, you walk in the door, there's hand sanitizer right there. Everyone you walk by is wearing a mask.
I just want to reiterate that it's really important that if you're sick, you need to be evaluated. And especially in cancer patients, anything can happen at any time. You can get infections, you get bowel obstructions, or anything can happen. You can't delay that treatment because you're really putting your life at risk.
This is a safe place to come and get your treatments.
So we want to assure you that we're safe, we're here to care for you, we're always open and available. Our physicians, our staff, our facilities are ready to take care of this community in Palm Beach County.